Well, good evening. And I'd like to call to order this committee of the whole meeting of the town of Saugeen Shores and extend a welcome to everyone in the council chambers this evening. Our first order of business is a declaration of pecuniary interest, and I remind every member of your responsibility to do so. We have none declared. Then the next item is additions, deletions, or amendments to the agenda, and we have nothing under that item. The next item is a delegation, and the first one is Roger Cook, and I don't see Roger here this evening, so perhaps we'll move to, I see our second delegation here, so perhaps we'll move to our second delegation is Sarah Ellis. She's the Chief Nursing Officer and Program Manager for the Grey Bruce Health Unit, and she's here about our opioid crisis and a call to action. If you don't mind, Sarah, just introduce us with you.
Sure. I'm Sarah Ellis, and this is
Dave Roy from Hope Grey Bruce Mental Health and Addiction Services. I'm the Program Director for Addiction Services there.
Welcome.
Thank you.
Thank you. We're here to talk about the opioid crisis. Some of the objectives of our talk is to increase awareness of the issue of opioids and to be aware of what role municipal leaders can play in this crisis. To start with, we thought we would just review what's an opioid. Opioids are from a family of drugs that have morphine-like effects. They're mostly used to relieve pain, but they can also produce euphoria, making them prone to abuse. The most commonly misused opioids are prescription drugs, and opioids are depressant, which means they slow down part of the brain that controls breathing. To put it into perspective, the opioid crisis by the numbers, one person dies every 12 hours in Ontario from an opioid overdose, and 1 in 170 deaths in Ontario is now related to opioid use. 1 in 8 deaths of young adults is related to opioids, and that's growing all the time. Compare this to other deaths in Ontario. We can see that motor vehicle deaths in 2014 were 481. In streptococcus pneumonia, which is a pneumonia that some older people get, typically was about 623. And as you can see, opioid-related deaths in Ontario was 673. So it really puts into perspective the crisis. We're not exaggerating the crisis. It's real, and it shows in the numbers of deaths. In Grey Bruce, we know that opioid-related emergency department visits have tripled in the past 14 years. Acute opioid toxicity has increased 2.5 times since 2002. Between 2010 and 2014, Grey Bruce had at least 9 deaths related to fentanyl. And there is a new opioid tracking tool from Public Health Ontario that can help us get more up-to-date opioid stats. So you can see from this graph, it has the rate of opioid-related hospitalizations by health unit region. And you can see the rate per 100,000 for Ontario is 13.7 average, and Grey Bruce is sitting at 24.4. So you can see on the map that dark purple means that we're fairly high in opioid-related hospitalizations. We also know that it's complicated. How we got here is very complicated. And there's some, I don't know if it's blame, there's some cause for concern for the marketing that happened around opioids that were thought to be a safe pain management tool. In Ontario, prescription narcotic use is 2 to 4 times higher than in other provinces, so we know that the marketing that pharmaceuticals did for a while in the 1990s was very successful. We also know that we got here due to a gap in services. There's not that many chronic pain clinics. There's lack of addiction and mental health services, both inpatient and in the community. And we know the social determinants of health, such as lack of affordable housing, poverty, have resulted in this crisis. And we also know that there's a stigma associated with people who use drugs. That we tend to look at drug use as an individual lifestyle behavior rather than a community responsibility. We also know that the clinical guidelines for prescribing opioids have changed. The trends in high-dose prescribing have decreased, but there hasn't been any increase in mental health or addiction services. And again, there's lack of understanding and treatment options for chronic pain. We know that the problem is big and it's very complex and it's worsening. So some of the solutions that we need to think about need to be comprehensive and timely and evaluated. We know drug use is happening in our community, and reducing the negative consequences is going to take a collaborative community response. And it's a health issue. It's not a crime issue. It's a health issue that can affect all of us, our family and our friends and our neighbors.
We want to let you know a little bit about what's already happening in Grey Bruce. We have, for a number of years now, had the Grey Bruce Task Force on Crystal Meth and Other Drugs. It's currently undergoing a bit of a rebranding, and you'll see it morph into a more broad-based community alcohol and drug strategy. We have the opioid working group, which the health unit took the lead on fairly quickly, along with the coordinator of that other task force, to pull some municipal folks together, some doctors, service providers, to talk about how we can band together to address this issue in our community. There is a rapid access addiction medicine clinic that operates out of the withdrawal management service in Owen Sound. If you're not aware, we're very lucky in our area to have a withdrawal management service. It used to be called a non-medical detox. So it is a place where people who are intoxicated can go to detoxify in a safe manner and then get connected with treatment resources. The RAM Clinic started as a research project, and Grey Bruce Health Services has decided to sort of try to support it, even though they don't really get funding to support it. What happens with that clinic is that doctors in the ER are trained to recognize addiction issues quickly, start folks on some medications that can support them, substitution therapy such as methadone and Suboxone in the case of opioids, naltrexone in the case of alcohol, and then try very quickly to connect them with the doctor at the Rapid Access Addiction Medicine Clinic, who will then make referrals to community treatment like my programs and liaise back with primary care doctors so that their care can be continued. There are a number of clean needle exchange sites around both counties. We have upped our game in terms of naloxone distribution. For those of you who don't know, naloxone is I guess the best way to describe it would be an antidote to acute opioid overdose. So somebody's in an overdose position, they can't be roused, you administer naloxone, and it brings them back. It's quite a dramatic thing. It gets them stabilized, gets them to hospital. There is a harm reduction support group that's offered out of the Safe and Sound Community Services in Owen Sound. We've had a number of events to try to highlight the opioid crisis, including at a barbecue at Safe and Sound to highlight International Overdose Awareness Day. And we are traveling around to a number of municipalities to offer this presentation so that we can give you good information about the scope of the crisis and also the services available and what we're trying to do. I'll probably screw this up. We also want always to be advocating for treatment services. Here, like in many parts of the province, addiction treatment services are woefully underfunded and under-resourced. That is wrong there, actually. We currently have 13 full-time counselors and 2 part-time counselors to offer services across all of Grey Bruce. 3 full-time counselors and 1 part-time counselor to offer services for youth 20 and under in Grey Bruce. Those counselors go out to all 11 high schools to offer outreach services, but you can imagine that they can't be in the schools every day with that limited resource. There's no ongoing funding to maintain or expand that Rapid Access Addiction Medicine Clinic. It is very difficult in a rural environment to avoid running waiting lists. So all of my counselors see folks in Owen Sound at our main office, but they also try to offer services around the 2 counties, including the Shoreline. I have somebody that goes to the Southampton Hospital, and we also hit Kincardine. But it's very difficult because of transportation issues, and to get to every community is just impossible with the limited resources. Access to supportive primary care, perhaps saying it's a problem is a bit of an overstatement. It's an issue, though. We need to engage doctors in this discussion. Doctors they're key to addressing this issue. We need to expand the number of doctors who are comfortable in prescribing substitution therapies. And again, access to those substitution therapies is a bit of a challenge. So we are continuing to try to develop a community opioid response. We have been in touch with the Ministry of Health. We were able to have 2 of their representatives come and attend one of our meetings by teleconference. I don't know if you've seen recent announcements about the Ministry of Health's investment in treatment. They're saying $222 million is going to be invested. 70 million of that is supposed to go to community mental health and addiction treatment. I haven't got the letter yet. So until I see the money and see the resource, it's hard to get excited about that, but this is getting a lot of traction. We're trying to increase monitoring and surveillance, prescribing practices. We're trying to work with physicians and nurse practitioners and pharmacists and dentists about safe prescribing, increase public awareness, provide education to our target groups, and to engage municipal leaders like yourself on this issue. What can you do? Well, you can understand the opioid crisis as an indicator of overall community health and see substance use issues as a health concern and not a moral issue. The folks that we are seeing in our office, the folks that we're providing treatment to, they're our friends and our neighbors. They're generally not out looking for a good time. They got addicted because they're trying to avoid some kind of pain, either physical or emotional. So we can avoid stigmatizing people who use opioids, and we can think about what level of harm reduction support do we have in our communities. Do we have a program for community sharps disposal? Do we have a needle exchange? Do we have naloxone, that life-saving substance, available for residents?
We can also use an health and all policies approach. When you're thinking about policies, you can think about how this would affect those most vulnerable. We could also look at advocating for funding to address the root causes of addictions and mental health, and the need to increase support for those most vulnerable, such as safe and affordable housing, access to healthcare services in their community, transportation, and childcare and social support programs. That's our presentation. I don't know if we have time for questions.
We got lots of time, Sarah. Thanks very much. Any questions? Or Councillor Grace.
Thank you, Mr. Mayor. Thanks for your presentation. I have a question about fentanyl. You hear a lot about it. I understand its use is growing. Am I right that it is it illegal? It's synthetic? Is it prescribed, or it's illegal?
It can be both prescribed, and there is synthetic, illegal opioid or fentanyl that is mostly imported from Asia, I would think.
Okay, because I read an article recently indicating that that's like the leading cause of opioid death in the States now, according to the CDC. And what percentage of our problem is fentanyl in our area? Do you know?
It's hard to say, but because fentanyl is a lot cheaper, sometimes the people who sell drugs may cut some of the drugs with fentanyl to give people that high. So I think it's probably laced a lot these days.
We're making some headway with fentanyl, so it is usually prescribed. It's a very powerful opioid analgesic, so it's generally prescribed in cancer cases where there's extreme pain. The government has moved to try to lower sort of the dosage, so so they're not creating these high dosage patches. There's also a patch for patch program. So if you are appropriately prescribed fentanyl patches and you have them, before you can get more, you would have to turn them in. It would have to be a patch for patch trade-off. So they know that the people bringing them in, they're legitimate. So there's some headway being made in that.
Thank you.
Yeah.
Councillor Dave Mayette.
Yes, thank you, Mr. Mayor. And through you, thanks, Sarah and Roy, for highlighting this problem. The Deputy Mayor Luc Charbonneau across the way and I hear quite a bit about this as we sit on the Police Services Board, and this is a hot topic with the Police Services Boards around the province, and everybody is concerned, but no more than the people at the front lines on the police for their own protection and for the stories they hear about this coming in, and most of the operating experience that they have is coming out of the West. This stuff seems to have got a hold in BC and is shifting this way. How much of that experience, and I know I know we're kind of inventing it as we go along here because this is coming on so rapidly, and our systems are so, as you pointed out, are so inadequate for handling the volumes of people who are potentially going to be showing up on our doorsteps with this problem. How much of that experience can we get out of the West and learn from their experience and their mistakes, and hopefully not see the epidemic levels they're seeing in places like Vancouver?
Well,
We hope a lot.
we're trying to learn as much as we can. So the coordinator of the Task Force on Crystal Meth and Other Drugs is constantly scanning, is in touch with other community drug strategy groups. Tried to bring everybody to the table. So we have police representation at that task force. We have police representation on the opioid strategy working group. Because I know that I certainly don't have all the answers, and in treatment I can get in my little bubble and just deal sort of with the people that come through the door. So we are trying to gather as much information and have as broad a perspective as possible.
I was wondering, is there like a national task force where representatives from across the country can get together and share their experiences?
There is a national opioid strategy by Health Canada, and it has some of the aspects, but certainly we can learn a lot from BC. And recently the government has announced those safe injection sites, so that's one step that BC took a number of years ago that has seemed to decrease some of the deaths. So hopefully we can implement some changes more quickly so we don't end up in the same spot they are right now.
The government of Ontario just announced 2 days ago that they're putting together a provincial.
Vice Deputy Mayor Huber.
Thank you, Mr. Mayor. Through you, I'm curious, are you making the same presentation to County Council, or have you already done that?
No, we have not done County Council.
Well, I would encourage you to book that appointment, because one of my questions was related to some of the items that you've got on the list for what municipal leaders do are items that the county pretty much plays a leadership role in, even more so than we do. So I was going to ask you that question, then I was going to ask the mayor how county council reacted, so I'll hang on to that. But I would encourage you to do that. Do you have any, in the presentations that you've done so far, is there any one item that you can isolate out as something that another municipality has kind of stepped up and thought was one way that they could approach some of the items and ideas that you had in here? Do you have any exact?
I think one, I've been working a bit with Brockton to do some safe sharps needle disposal bins. So I think they're doing them in some of their community sites. So they didn't kind of take it as an opioid strategy, but kind of for their accessibility committee, looking at people who use needles, whether it's intravenous drug users, diabetics, other people who are on needles. So they have taken that and have tried to incorporate sharps bins in some of their centers. So that was one thing that's kind of more practical and maybe easier to check off the list rather than some of those other bigger goals.
3 of county councillors sit on the Grey Bruce Health, and they represented us here last week, I guess, or 2 weeks ago. Yeah. So, but Councillor Minaj.
Thank you, Mr. Mayor. So, understanding opioid crisis as an indicator of the overall community health. So, who's doing that statistical data gathering information for us? So, that's a leading question. You don't need to answer it. Thank you. But what I would like to ask respectfully is that there are 2 slides here that say what we can do as municipal leadership, and yet I look at it and I'm confused. So you're asking me if we have a program, or we're asking us if we have a program for sharps disposal. Wouldn't you know that answer to that question? Like, how am I supposed to know that? Like, we're not in the business of health, other than and clinics and doctors, but to drill in that deep to know whether we have, or whether we should have, or whether we should be the leaders of, that's difficult for me, and I'd like to go through these just quickly and say, I don't know anything about it. I understand the question, but I don't know what we're doing in our community. I don't know about needle exchange services in our community. available for our residents. And I don't know if we have Naxaline available for residents that need it in our community. I have no knowledge of this. So you're asking me to provide you with answers or provide leadership with this, and yet I don't have any method to plug into this to find out. I can dig, I guess, but I don't even know if that's my role as a municipal, local municipal leader. So, and when we go down the list and it says you have safe and affordable housing, I know we don't have affordable housing. I know how difficult it is to get affordable housing in our community, and I would like to suggest that we can have that roundtable discussion, and we could put all of these together possibly, and start indicating who does know how we get affordable housing, and what is it that we're going to do to actually make it happen rather than just talk about it, because we continue to just talk about it, and we continue to see a slide that says you should have affordable housing, and that's the end of it. It just disappears into the air, and I don't know. Access to transportation, I'm assuming that's transportation for, actually the previous speaker would have been talking about our smart transportation. So I think that we're leading the way in access to smart transportation. So, and childcare and social support programs. And I really, that's a wide range. So I don't know what it is that we're not doing in this community, or what we can do for next steps to get us to where you want us to be, because I don't know what those pieces are. So I would like you to come back and come back and talk about those two slides in more detail, and expand upon it, and agree with us. We can agree to action ourselves to have that roundtable discussion. Thank you.
Go to Deputy Mayor Charbonneau, then we'll go to John.
Thank you, Mr. Mayor, and thank you guys for coming in for the presentation. I was interested in your comment about, I think the words you used were upping our game in terms of distributing naloxone. The Saugeen Shores Police Service is currently working on a policy to outfit our police officers with naloxone. That's, in my view, from the standpoint of officer safety, something we need to do very quickly. I mean, we need to get that done soon. But there is some.
I think we're coming this week to do some training with Saugeen Shores Police.
Nice. Well, that's good. And I guess one of the subjects of conversation around that policy has been the supply of naloxone, and the need. It's a drug, so it expires. If hopefully we never need to use it, but if we never need to use it, we need to throw it away and get new stuff. So we need a constant supply, and I think too, it's something we need to look carefully at. I suspect when you do finally talk to the county, and even here at the town of Saugeen Shores, I think it's something we need to consider for our first responders across the board, including fire, and to make sure they're outfitted, make sure they're trained, and make sure they have that. I think first and foremost to protect themselves, but if possible to save a life, which I know they won't require any directive from us to do that if the potential arises for them to do it. But I think it's an important thing for us to understand the details about the supply of naloxone. I don't expect you to provide them all right now, but I would like some assurance that there is going to be a supply. It's going to be enough to meet those needs, probably needs that are going to grow, because I'm hoping we'll outfit more people with it, and hopefully maybe find a way to make it accessible to the public. So could you just elaborate on that, on how you're upping your game?
Sure. I know that the Ontario Ministry of Health announced back in June they're going to make available, I think it was, 69,000 more doses of naloxone per month. So certainly the supply is there. They were, I will use Dave's words, woefully absent in their mention of how we are to address EMS. So what we've been doing from a public health standpoint is going around and offering training sessions as people have asked, and we will supply naloxone to people. We won't ask the questions that we're supposed to ask for our ministry mandate, just because we know that it's so important to get it into their hands. So we've kind of been trying to fly under the radar with that, but certainly that is not a solution, but it's what we have come up with to address the needs of local EMS.
You have enough. There's enough supply.
Lots. Yeah.
Okay, thank you.
Councillor Rich.
Thank you very much for your presentation. I do have a couple of questions. One, we do have a needle exchange program here, right? So you can do needle exchange at pharmacies at all times. And naloxone. And naloxone. You get naloxone at pharmacies as well, right? So I was looking at your presentation, and there's one point where you talk about addiction treatment services being woefully underfunded. What kind of advocacy are you guys involved in as far as that goes? Like, how do you change that? Because I do know that certainly a lot of the addiction treatment services, just in small.
Boy, I wish I had an answer for that. I would love to know. I've worked in this field for 26 years this year. Young people. Back in 1991. And so now I sit at a couple of provincial tables, Addictions and Mental Health Ontario. I chair the provincial youth sector. There's at meetings and lobby for additional funding. They are slippery. So far we have not seen a significant injection of resource into the system. So in all my years, I mean, very little. We've had increase, but it has not matched the demand by any stretch of the imagination.
The other thing that you talked about was talking about addiction services. So first off, working with physicians and dentists to make sure that they don't overprescribe opioids, I suppose. But at some point, you said something about getting more physicians trained to drugs like methadone.
That's right.
Yeah.
That's about it. Yeah.
So I know that is a very arduous process to kind of go. Were you aware that the provincial government cut funding to methadone by 50% 2 years ago? Yeah. So that also makes it a bit more of a challenge to get other physicians on board.
So
Are you doing anything is there anything that can be done to try and help that?
Well, we're certainly lobbying all the time, and we're trying to. I mean, methadone, to get the license to prescribe methadone, that is a more onerous process than just prescribe something like Suboxone, which would be a substance that, research-wise, is equally as effective. Although there may be times where methadone is seen to be more effective, depends on individual cases. So we are trying to get the word out regarding Suboxone to physicians, that they don't need a special license to prescribe that substance, and there are other doctors in our community who are available that they can consult with if they feel they're out of their depth on that. So we are trying to connect those docs with other docs who are more well-versed in prescribing substitution therapies, including the doctor that works 2 days of the week out of the Rapid Access Addiction Medicine Clinic. And she's more than happy to take a call at any time from a physician who's wondering about how to start the induction process for Suboxone.
If I could have one more question. I'd also was kind of curious because somewhere he talks about the task force of being for crystal meth and other drug strategy. What kind of progress are you making on crystal meth? Because as far as I understand, that's something that's often placed in Canada. Wide variety of drugs and actually almost as many problems.
Yeah, I mean, it's difficult to know if we're making headway, to be quite honest with you. The coordinator is working on trying to pull together a research working group to see how we could get better data to tell us, where we are with crystal meth. Certainly, it's continuing to be an issue. The police would tell us that production, like local production, we made a lot of headway early on because we had the Meth Watch program, so someone's ability to buy the precursors to put together to make those substances, that was curtailed, and production moved out. Now, the downside of that is I think it moved out to probably bike gangs out of province who make a very high-quality product, and then they just sort of truck it back in. But we did make a lot of headway around production. And I'd like to think that we made some headway in terms of the treatment side of things, but treatment agencies, it's difficult for us. We can't be the good source of data there because, sometimes people just don't necessarily come to treatment. So if I'm not seeing a lot of crystal meth folks come through the door, it doesn't mean that the crystal meth problem has gone away. They're a very tough crowd to get into treatment because you have a very, very small window if they're in an acute sort of using phase. And then when they crash, you have a little window where there's some coherence, but then people people are out for the count for another week, and then you might get that window again in a little while. So it's hard to engage people. So still a problem, no
Yeah,
question.
we know from our stats, we collect stats on all the needle exchange clients we see. We distribute over 93,000 needles last year, and we know that crystal meth is in the top 5 of the substances used, as well as opioids and speed, and heroin. So that's kind of gives you perspective from the addictions, people who are seeking treatment, and also the people who are currently using, that it is still a problem.
Well, thank you, Sarah and Dave, for your presentation. We spoke a little bit about the crystal meth task force, and I know when we struck that force a number of years ago, I believe about 8, the counties, both Grey and Bruce counties, put some money and continue to fund that, and I sat on it. One of the difficulties that as you sit on that, it is not an easy problem. The thing that was reinforced every time you would go there, that this is not an easy solution. This is a solution that takes a whole broad range of approaches and people and agencies. And, we often ask the question, what would you do if we gave you unlimited resources? And the answer was not easy, even if you had unlimited resources, of how you would deal with a problem like this. But it's encouraging to see that the provincial government has finally started to say that this is a problem. When you're talking about more people dying from this particular drug than in car accidents, and you think about the resources that we put into making roads safe and cars safe and enforcement, it just staggers the mind to think that we really kind of ignore this thing. And I really appreciate the work that you do both at the Health Unit and at Hope Grey Bruce and at the Crystal Meth Task Force. So thank you for coming tonight. So we don't have our other delegations, so I guess we'll move on then to the next item on the agenda. Excuse me. As a Planning and Development Staff Report, it is a pre-servicing agreement with Red Hawk Construction Limited, and I believe our Director of Public Works, our Development Coordinator, is that the, I'll get it right here.
Well, we'll also, depending on
you
questions.
Just call it, it's going to be Jay.
Jay.
Okay. We'll note that, Mike. Thank you.
Yes, thank you. So there's actually 2 agreements that we're putting forward here. One is a pre-servicing agreement, and the other is a model home agreement. They're both attached, but I just want to highlight that this pre-servicing agreement is very similar to one you've already seen in April for the Northport Meadows. And although the unique features of this one are because we work very closely with not just the developer, but Bruce County Highways Department to ensure that the agreement met their requirements for access, for insurance, and any other terms and clauses that they required. So just to highlight, this is just for external works to Phase 1 of the West Link subdivision. It would be the external works to a certain point, and so there I'm saying that they include storm sewers, water main, and sidewalk within Bruce Road 17 and Gustavus Street, but it does not include sanitary works for future phases or any of the bridge works. That'll be under a separate process to be approved by the county, but in conjunction with town staff. So I just wanted to highlight that. The second agreement is a model home agreement, and I've noted that it's a little unique to the town to have this. Previously, we've incorporated model home terms into our subdivision agreements, but because there isn't a subdivision agreement before us, but we still want to allow the developer to market and sell his product while he develops the subdivision. This was the appropriate tool for that. So in this case, the model home agreement would allow townhouse dwellings or a series of single detached dwellings within that first phase to be constructed by the developer. He would secure the construction with the town to ensure that if something happened over the 18 months and the subdivision didn't proceed for whatever reason, that we'd have the ability to have the model homes removed. And I guess that's all.
Thank you, Jay. Then the recommendation is that Council pass a bylaw to enter into a pre-servicing agreement with Red Hawk Construction Company Limited for Phase 1 of West Links subdivision, and that the Council authorize the necessary bylaw to enter into a model home agreement with Red Hawk Construction Company Limited. Questions or comments? By Stephanie Huber.
Thank you, Mr. Mayor. Through you to the Development Officer. The agreement about model homes, it's good to have something coming together for that, and I hope that if you do this and then you realize some stuff needs to be different, that you kind of adjust it, because it's a good document to have. When I read through it, though, it's the language sometimes refers to model home in the singular, and then it's model homes in the plural, and I'm understanding that I think what Red Hawk wants to do is have two different styles. So just, sometimes people who are not too happy about something, they'll find interesting language in the document that supports their way of thinking. So I would encourage you just to give it a good read, and if it should be plural, make sure it's plural. I did want to ask, though, I could be wrong, but I don't think we've yet had the site plan come that shows whether we took a parkland dedication or cash in lieu. Has that been determined yet? And if it has, perhaps I've seen it, but could you just remind me of what the decision was on that element for this development?
Yes, we haven't settled on many of the terms for parkland acquisition. We did for the site plan for the golf course redevelopment. We took cash in that regard, but when the subdivision agreement for the first phase comes in, we intend to have that resolved as well.
Councillor Grace?
Thank you, Mr. Mayor. Jay, my question is about the insurance on clause 17, and it talks about, that's on page 20 of our agenda. No, I think it's in the pre-servicing agreement. So it talks about the amount of no less than $5 million. And it covers the co-insured of the town, county, and the engineer. So my question is that $5 million split among those three parties, or is it $5 million each?
I don't know enough about insurance, but maybe Amanda does.
Okay, thanks.
Sure, it's $5 million per claim, aggregate through the year, so I'm not sure how it works. All it means is that if someone was to sue us, the county, the engineer, or Red Hawk, it's all under that same insurance policy. Right.
More than $5 million? Like, what I was wondering is, does that mean it's $15 million, or because it doesn't say up to $5 million, it says no less than, so it implies that it could be more than $5 million.
Right. It's up to their discretion. But our insurance is $5 million as well, so we make sure that the developer carries at least the same as what we carry, so that we're not on the hook for the difference. So if they felt like having more than that, would be up to them.
Councillor Minaj.
Thank you, Mr. Mayor. I discussed some of this with Jay earlier today, and maybe I can advance some of the discussion with Amanda as well. Is it possible to understand a timeline that would be presented that talks about a water tower that's coming down? Eastwood is going to be redeveloped. We've got a bridge that's coming partially down. We've got a very big development here. This is all taking place in about a 10-block area of the community right beside the high school. And so knowing when all this timing is going to take place and all the heavy transport trucks that are going to be involved, and maybe we could put up some cautionary reduced speed zones and some extra signage that trucks are turning. I'd like to just know that we're taking an extra safety step here or two, and ask if we can get some feedback on that, because I believe that a lot of this could be happening during the winter as well, and we know that that particular part of the road gets plenty of snow and ice. So speed on that road is a particular issue. It is a busy road. So I would hope that we could get some sort of single line diagram, overall plan that says all of these projects taking place, and what and if anything we can do about it to add to safety. Thank you.
I think I will comment. There's a number of different projects that will depend on budget approvals both here and at the county. So, I mean, I don't think Amanda will be in any place to make any decision about when these projects are going to go ahead until we've made the decision here at the board here, or the council. But I think, I'm sure we can come up with some, you can speak to it, Amanda. I'm sure well versed in traffic control.
Yeah, so the Ministry of the Transportation will dictate the traffic control for sure, and the speeds are always doubled in construction zones, so those signs will always be out there on the county road. But we can put together a timeline of when we see the water tower and the roads in the area. We have to do that to figure out detours if we've got combined projects anyway, so we can bring that back, but that would be in 2018. They're looking at doing this one starting in 2018. There's a part in their contract where the developer is willing to pay the increased fee to have it done faster. So the intention of the bridge would be to start construction in 2018. The water tower would not be that time frame. So those are two large projects that I know will be offset from each other.
Yeah, the county just gave direction to the engineer to proceed to tender for that bridge this fall, and construction begin as early as February, and with an end date as early as May the 1st. And so that hasn't been finalized yet, but that was the direction that the engineer was given. So, Vice Deputy Mayor Hubert.
Thank you. Councillor Grace's reference to a particular item reminded me of something. There's a very definite sentence in here. It's item 18 in the pre-servicing agreement. It's titled Tree Removal, and it reads, the owner shall remove only those trees required for the installation of works comprising underground services as determined in the field by the engineer, and the engineer that they hire, and is approved by the town in writing. I'm assuming that the approval by the town would be likely through the Director of Public Works office. Is that okay? I'm glad to see this here. How do we make sure that this is actually happening? So I notice elsewhere in the agreement that there's reference to certain services and things being paid for by the developer, and there's a deposit sort of situation, and it shows up with different kinds of numbers. Is this something that our arborist could be sent out there to take detailed pictures? It could be, put into the list of services that we then get funded for, and we have a record of what's there before it starts, so that we can actually start to understand that when we're saying that we're going to protect trees, that we're actually doing it. Because I'm glad to see this here, but it's without any sort of before and during and after indications along the way. It's easy to see how it would just be lost. And I was happy to see in the Grenville Estates project that some comments that were made here around the table about, doing what they could do to protect a couple of trees along Gray Street in particular, because they were starting on that side. And they did. They kept a couple of big trees up and worked around them. So I would just really like to know how we can actually see this one through, because it's a very short sentence, but it says a lot, and I think it would be a good policy or practice for us to know how we can do it. And if it fits into some of the services that we're saying are expected from our side, but it's expected that they get paid for from the other side, this may very well fit onto that list. So, it should be a win-win and possible. I just leave you with that thought. Thank you.
Well, certainly in the review of the engineering drawings, the developer's engineers provide information about what doesn't have to be removed, and shows the limit of construction, so we know as staff, when the drawings approve, which trees should or shouldn't be removed. In this case, because it's in the road allowance and only the county road allowance, I'm not sure there's any trees required to be removed in this case, so I'd have to defer to our reviewers to be absolute in that case. It is something that we want to see more of, because it is something that we recognize is important to the community and to the town, the corporation as well. So we just recognize it more directly and objectively than in the past, maybe.
Okay, Deputy Mayor Charbonneau.
Mr. Mayor, a comment and a question. The comment is that I'm once again extremely happy with the work that you all have done in order to be flexible and to allow these pre-servicing agreements and this agreement for the model home to come forward in the way they have, this flexible approach to allowing these subdivisions to move forward expeditiously in a way that protects us, but also enables the developers to move forward, and so that they can have profitable ventures and be successful is extremely beneficial. And I think reflects well on the municipal administration. So I just wanted to say that. My question is a simple one with regard to the draft model home agreement. Point 17, the owner acknowledges that there's no fire coverage until all services have been installed on the subject lands. I assume that what we're really saying there is that that we will, like if the place catches fire, we'll respond, but we can't respond with municipal water because there's no water there. But we would respond as if it was a rural home. I mean, it's not as though we're not saying there that we wouldn't put out a fire if the place caught on fire. Am I right about that?
You're correct. When both parties reviewed the agreements, it was the understanding that because there's no charged water main, it was obviously couldn't provide a hydrant service, and I confirmed that with discussion earlier today.
Okay, thank you, Mr. Mayor.
Any further questions? All in favor of the recommendation? Opposed? That's carried. So, back to our agenda. The next item on our agenda, there's a number of minutes there, and they're in the binders for you. But we have a report from Councillor Minaj on the AMO conference in Ottawa.
Thank you, Mr. Mayor. Okay, so this was a small report about my attendance at the AMO, Association of Municipalities of Ontario Conference in Ottawa this past August. And we were lucky enough, those of us that attended, to be put up at the West in Ottawa and have the Shaw Centre be the focal point for all of the sessions and trade shows. We didn't get started without some controversy right at the very beginning. So this gentleman, Nick Nanos of Nanos Research, well respected and had slides, 100 slides. And these will all be available to everyone shortly on the AMO website. This particular emphasis is that AMO was looking to ask for a 1% increase in the HST to be solely dedicated to municipal governments for infrastructure projects. And he had many indicators that it would be supported. Kathleen Wynne actually sat down and spoke to it and said, well, it's not what we're trying to do now. We're not trying to increase taxation on the public, so we'll find another way to boost funding for municipalities. So it was shot down pretty quick by the Premier, and that was her choice, I suppose. But it looked like a good one, and it would have certainly helped with all the bridges and in particular bridges and roads and buildings that need help. This one, so the whole conference was Mobilization Meets Main Street, and this one grabbed my attention too because it's about the forestry industry that we have in Ontario and how vast it is. And it's so big that we could join the boom of wood being used in the world and put together new trade agreements, and we should be able to put those wood industries back in business. And it was very evident that the speaker was very passionate about it, being the CEO as well and the research chair. So it captured my attention, and I wondered why we can't do that. Be one of the big providers of wood for the world, and if we harvested less than 0.5% annually, you could see how big it is on the big scale of things, and we would be a major player in the world's need for wood. So that's kind of interesting. Very busy Monday morning. In the end, I ended up attending increasing participation and equitable representation. And one of the interesting ones there was, I think it was Kenora, the town of Kenora, that was adding a high school student onto council. And they didn't have any voting rights, but they had full opportunity to participate and be involved in the discussion and bring that youth perspective. I thought that was interesting. So obviously the world is changing. Can we compete? So I get that they're speaking to the broader, larger communities as well. It's all communities, all 444 of us, I guess. But certainly we can find new opportunities, and can we adapt was the theme there. Tuesday morning, I attended the 3 hours of disaster, and this particular one caught my attention because I guess it could happen anywhere, anytime. Unfortunately, this was 2 fatalities and murder-suicide, and they blew up a half a block of Mississauga. And many of the people that live in those homes around have not been able to live in those homes around, and they're still not there. And what does it mean? It means a lot of things. In Tecumseh, they had a lot of rain, and we all know what a lot of rain can do, but they managed to get about 200 millimeters of rain total in a very short period of time, and they had 300 calls into the town hall to help, and they also had 100 license plates were recovered, which was interesting. The biggest issue was the lack of backflow valves preventing sewer flooding, so I suppose we need to ask ourselves where we are with that in our community. So they talked about programs that can pay for the installation of backwater valves, public information open houses. In Mississauga, they had to use robocalls to keep residents informed, and there was a big thing about the media as well, and having a unified command, and these were lessons learned in making sure that it was regular and it was everybody had the same answers. So the overall lessons learned: do we have a disaster reserve fund? And I don't know that I can answer that. I look at all our reserves, and I don't believe there's one that talks about disasters. So maybe it's something we can enter into discussion at budget time. The constant message: extraordinary circumstances require extraordinary responses, and so on. So remember that in Tecumseh in particular, they were asking the town to respond, and many of the town's staff had flooded basements and were trying to deal with their own problems in their own homes, and yet they were being asked to respond to other people's needs. So that was an interesting one as well. So tabletop emergency plans at least once a year, and I know we're driving to that if we're already there, but we've got more coming, and that'll come out of our emergency management committee meeting. You'll see that soon. Tuesday morning, cannabis legalization, municipal impacts. There's some interesting ones here. Of course, everybody was talking about, do you really want it in your downtown retail area or your BIA? You can regulate it by zoning. So my understanding is that staff may very well be looking at where we're going to fit this in. Are we going to stipulate it into a specific zone? And the recommendations are that we should. Where can you smoke cannabis? It's not like cigarettes, and it's more like beer. So don't be naive, be adaptable, because we want to get it right early. And that message came from a couple of the states in the United States of America that put some very onerous restrictions in place and realized they had to undo it and rework it, repackage it. So if we're going to do it, if we're going to allow, we need to get out in front and ahead of it. So it's going to take place next year, right? The full licensing package. So we should be having that discussion as a council now, is what my takeaway. Municipal infrastructure projects, big one on that, and municipalities own 60%, and they're generally considered in fair to poor condition, and we already know what ones are in trouble in our municipality. So I think we're doing well, but everybody else is big on discussing how that's going to take place. And we looked at all these different models that are happening over the world, and which one is the best one for you. Blue Box, it was an interesting thing about Blue Box as well. It caught my ear and eye, and that was K-cups, the little cups that you put into the coffee makers, and it was like, you can't recycle those. And the answer was, we shouldn't be worried about it, because it takes less greenhouse gases to produce that plastic than it does to produce other problems. So they're trying to marry the two together and say, what plastics are causing us more problems. We should be recycling those, and we shouldn't worry about the ones that are the least amount of problem and the least amount of green gas emission type development. So it was an interesting approach, and they emphasized heavily that it's effective recycling is a product of effective communication and education. It's our program. We own the challenge. So I think that we could certainly look to improve there. We had an evening reception at the Canadian Aviation and Space Museum, and I bumped into these two extraterrestrials while we were there. So they must have come from out of space somewhere anyway. A couple of good-looking guys. I don't know about the suntan. Maybe how the picture makes that dark. Linda, did you mess with that? Did you Photoshop that? Okay, so transparency and accountability. And this licensed psychologist, he would deadpan the audience, and you would not believe how humorous this guy was. And he made his points, and he put out a bunch of red flags for problems with accountability, and left us with a few very truthful nuggets. We actually hate being honest when it's tough to do, and we'll only do it just this one time. So these are things that we should be challenging ourselves with as well. And I'll finish it up by saying that Ottawa is a beautiful city and obviously our nation's capital, and there's lots of evidence of sophisticated green bike approach with computer billing systems on the bicycles and everything. So there's plenty of advancements, and we would want to hope that was true. Whether we can, how and when we get to follow them, who knows. Anyway, I'd like to thank everybody, and I'm willing to take any questions. I'm sure you don't have any, but if you did. And I thank the municipality and the taxpayers in supporting my attendance. It was certainly a privilege. Thank you.
Thank you, Councillor Minaj. Councillor Mike Meyer.
Thank you, Mr. Mayor. I'll just be brief. I just want to thank Councillor Minaj for his summary and presentation. I attended several of the sessions that Councillor Minaj attended, and if you haven't had the opportunity to attend AMO, it's my first time attending, and I'm sure most around the table have. Just a wonderful opportunity, Mr. Mayor, and again, thank you to the community for allowing us to attend. And it's the presenters there. I'd say were probably in all the years I've attended conferences and education workshops, probably the best I've ever heard. So that's a statement. I've been to a fair number of conferences, but it was just a wonderful opportunity and lots of good learning, professional development. Again, thank you to Council and the community for allowing me to attend.
You. Any further questions or comments? None. Then the next item on the agenda is a report of department heads. We have 3 information reports there this evening. There's one that brought us up to date on our 150th celebration, where we're going to. The other one is an ICE extension report, and the final is the municipal election report. And if anybody has any questions on any particular one, we can hopefully get them answered. Councillor Grace.
Thank you, Mr. Mayor. I just had one question on the ICE extension. I wonder, it said that the August ICE was shifted to, and then there wasn't anything that it was shifted to. Is that supposed to be April? Okay, if you look at get the specific reference for you. It's on the first page, I believe. Second sentence under background, the August ICE was shifted to in an attempt. Did that mean, was that supposed to be April? I kind of gathered it was.
I think it's probably
report,
I suspect that too should be out of there. Oh. It's just in an attempt to balance out the impact of the.
It was just shifted.
Yeah, to balance the staff out, because I think the report goes on and talks about the difficulties with balancing staff during August when there's demands at other places in the communities. I suspect that maybe you can speak to it, Sia.
I'm sorry, through you, Mr. Mayor. I asked Jane about that. The August ICE is correct.
Councillor Rich, maybe it can enlighten us here.
I think we used to open the ICE 1st of August, and it was shifted to the 3rd week of August. So it used to be open earlier in August, and then we shifted it down to like the 20th of August, and then we extended April, so it shifted everything. That was the idea. So the August ice was shifted from the 1st of August to the 20th of August.
Okay, thank you.
Okay, any other questions? Councillor Madison.
Thank you, Mr. Mayor. And through you, the big thing to notice with the ice usage is if we open it, the people use it. So our facilities, I know it's a tough time in staffing, but we have some ideas that might help complement that. But there is a need in the area for the use of the facility. So if we open it up, we made some good money on the time that it was open.
Yeah, and I think what's enlightening about it, or where we'll go with it, is in the last paragraph there. The staff have identified some issues with trying to balance everything there, but so there will be discussions. Staff will bring some ideas and discussion around the 2018 budget about how to address that. So, Councillor Dave Mayat.
Yes, thank you, Mr. Mayor. Just before we close out, I'd just like to make a quick comment on the 150 report. I think I'd just like to close it out by saying what a terrific job everybody did that was involved, including Councillor Menage, who was on the 150 committee, and all the represented groups. The report comes out here to say that they minimize their costs and they maximize. Oh, and sorry, yes, I was getting to you. And the chair, yeah, Councillor Matheson on the other side of the house here, did a wonderful job as well. So everybody that was involved did a great job, and it was a wonderful 2 weeks of celebration, and even the events that took place outside of that 2-week window were managed wonderfully, and congratulations to everybody, and do it again in 50 years.
Thank you. If there's nothing else, then we'll take a motion to adjourn. Councillor Madison, Councillor Rich. Oops, sorry. Councillor Grace. I apologize for that.
Your question about the election report. And if I may, additional nominations. So if necessary, additional nominations will be received August 1st. When the nomination period, I thought deadline was July 27th.
Through you, Mr. Mayor, the example of where you would need additional nominations if you did not have enough. So if we need 2 ward councillors. If we only had 1, we'd have to open it up for additional nominations.
Thank you. Any further questions or comments? And we have the motion moved and seconded. All in favor? Adjourned.